Welcome to another episode of Answers for Families, and in this episode, we are going to be talking about type 1 diabetes, and I have two incredible panelists here with me. We have Gretchen and Kareem. Could you guys introduce yourself?
Sure. I'm Gretchen Waldman. I'm the clinical coordinator and diabetes nurse educator here at Boston Children's.
And I am Kareem. I am a licensed independent social worker, clinical social worker here at Boston Children's.
Fantastic. Well, we cannot thank you guys enough for being here and answering a lot of questions about type 1 diabetes.
Our
Happy to be here.
All right, so to get started, let's just start off pretty simple. And what is type 1 diabetes?
Sure. So type 1 diabetes is when the body no longer makes insulin. So the insulin is an important hormone that we have in our body that helps to break down carbohydrates and use it for energy. So the part of your body that produces insulin are your beta cells. And during type 1 diabetes, your body no longer allows those cells to make insulin. So you have to take insulin from the outside. So how our kids take insulin is by injections or by insulin pumps, and we provide education to help them succeed.
And what would you say, we know that type 1 diabetes is pretty common. How common would you say it is, and at what age do we tend to see it?
Sure. So the peak age is around 12 to 14 or so. We are seeing a lot more younger children these days have type 1 diabetes. We have an average of 2,500 patients in our practice, so pretty big practice. Roughly 450 or so kids on average. 1 in 450 children have diabetes.
So it is very common.
It is very common. So if you think of it in an elementary school, there's generally at least one child in each elementary school with type 1 diabetes.
Wow. And I think that's what is something that's so important is for like all the parents out there that may have a child with type 1 diabetes to know that they're not alone and that it is very, very common, and that we will get to some good resources that they can get connected with other parents that have children with type 1 diabetes.
Absolutely. Yeah. And it's important too for the kids to be connected, right? The parents, it's really important as well, but those kids need to know that they're not alone either. Yeah.
Very good. And then the next question, I know that Boston Children's has a lot of resources for families with type 1 diabetes. What are some of the resources?
Yeah, you want to start with some of them?
I sure will. So we are really, we have a really collaborative team here. So each child that we care for has their own team of diabetes nurse educator, mental health or social work supporter. They have a nutritionist. They have the endocrinologist. We all work as their team, and we really encourage them to use our expertise and resources. We also offer many different groups and classes that families can attend. We have an off to college class in the spring and summertime. We have information group classes for pump therapy, for early childhood. We have our Diabuddies group, which is really cool. So our Diabuddies group is our middle school aged group. They named themselves. We voted on the name. It's really cool. So we meet with them monthly, and it's really just a social group. We do scavenger hunts. We partner with Ryan Seacrest Studios and the other day we did Wheel of Fortune with them. So it's really fun just to, again, get these kids to understand they're not alone, and that there are experts that can help with them. What other classes or things do we have?
Well, I think the great thing about the groups is they're run by all of our different providers within the hospital. So there's endocrinologists, there's nurses, social workers, nutritionists, and so everybody's a part of these groups. And so our families and kids and parents get to interact with a lot of different providers and get to hear different perspectives, get support. And I think a lot of these groups are about just building connection and getting these families to meet each other, allowing the kids to meet other kids with type 1 diabetes, which we know is just so important, especially early on, but even older kids that are diagnosed. And so some of our younger groups are a really big hit for some of the kids, just to meet other kids and see how they're handling it, what they're doing, how they're coping, and also for parents as well. Another group we've recently started is our Family Advisory Council, which is for parents of children with type 1. And so this is something that we recently started that allows us as providers to take feedback from families that are in our program and understand what's working well and what are things we can improve on. So that's been a really fun experience for me and Gretchen to hear these parents and just what it's been like for them, for their kids to go through a diagnosis at Boston Children's and to really grow up with care here, and just how technology has changed, how care has changed. It's really been helpful for us as providers to kind of hear what's going on and find ways for us to improve our care for families.
And one thing that we actually came up with that is all of our new onset families now get a backpack. And this came from our Family Advisory Council. So in the backpack is measuring cups and spoons, a scale, a medical identification bracelet, say that I have, that the child has type 1 diabetes, and also a beautiful letter that our diabuddies made a great picture for the front, but then inside is just really a welcome letter for these families. Welcome to this new journey in your life. And then it also has, kind of our QR codes and information on our Facebook page, our Instagram site, and all of our classes to kind of advertise. So families are aware of the opportunities they have here.
Yeah. And I think there's a lot of resources. We're always adding different groups and supports out there. And we also try and connect families to supports within the community. There's a lot of resources for families with type 1 and chronic illnesses. And so we try to be in touch with what's going on and connect families as best we can.
Wow, that's incredible. I can only imagine like how overwhelming getting the initial diagnosis could be, but to know that there are that many resources that you guys help families get plugged into, I think could be very empowering and so helpful to the families. So I think you guys are definitely doing incredible work. So you mentioned a lot of people that are part of the clinic. So are all those practitioners all in the same clinic, or how does that work when a family gets the diagnosis and then they have all these pieces?
Sure. So when someone gets newly diagnosed, they have appointments with all of the providers, all four of the team members. We also offer a type 1 academy. So our folks who are diagnosed can go to an initial group class 1 week or so after diagnoses, and you meet with a nutritionist and a nurse educator again, just to kind of regroup on what was taught on the inpatient side and start them off on the right foot to kind of give them an idea of how our program works here. But we have 5 different satellites. So we have providers in Boston and the Longwood area. We have Peabody, Waltham, Weymouth, North Dartmouth. So for families, it's really important to make sure that it fits in their life, right? We want to see them every 3 months. So if they see a nurse in Weymouth but a doctor in Boston, we are all part of the same team, whether we're at the same site or not.
Yeah. And certainly for the families that are newly diagnosed, there's a lot of appointments they're getting, as I think anybody can imagine. And so like they have the Type 1 Academy. They also have a group that's run by our social workers. And so that's more of a kind of psychosocial focused group, where we're really checking in with the families to see how the parents are adjusting to their child's care and this huge change in kind of their lifestyle. And that's more focused on just how we can provide supports for the families, school-based, educational-based, transportation, different things like that. But again, it's another way for parents to connect with other parents and just get that support from our social workers, and then to be connected to the rest of the team as well.
That's amazing, because any diagnosis that a child has, it does impact the whole family. And so I think it's incredible that you guys are taking the whole family into account when you guys are making all these resources. So another resource that you guys had mentioned before we got on camera was some of the mental health resources that you have. And we know that some mental health issues, there's just a higher likelihood in children who have type 1 diabetes, whether it be depressive symptoms, anxiety symptoms, or disordered eating. Could you guys touch a little bit on that and then the resources that you guys have to offer for that?
Yeah, definitely. So I think we're definitely aware of research that shows people with type 1 diabetes are more likely to experience anxiety-like symptoms, depressive-like symptoms, or disordered eating. And we try to be really clear to families about that, not to scare them, but just to make them aware of what the concerns are. And so how we try to support that is by having early assessments as often as we can with families. And so this looks like whenever they're meeting with their endocrinologist or DNEs or nutritionists or social workers, there's typically some assessment in a variety of kind of formats to see how they're doing. And I think with having so many meetings early on, it allows us to get to know the families really well and get a sense for kind of how they're coping and dealing with all these things. And then from there, when we identify families that may be struggling more or may need more support, our social workers are available to provide support for the kids and for the parents. You know, like you said, we recognize parents are affected just like their kids are. And so finding a way to support everybody in the family is a huge kind of goal of ours. And a lot of that collaboration comes from us communicating as a team and working together.
We also have looked at other, other departments at the hospital as well to kind of partner if we're feeling any of potential disordered eating or things like that. We work a lot with the adolescent program and really just to find any support that is right for that family. Diabetes is very individualized, and we really want to make sure that our families get exactly what they need.
Yeah, I think there's a lot of psychoeducation that goes into it, and for families to understand, what is anxiety, what is depression, how does it actually present for somebody, recognizing it's different for a lot of people, and some people can hear those things and rightfully so feel really scared. And so a big part of what we try to do is educate and support what families may be expecting versus what they're actually seeing. And so having those opportunities to have open conversations, educate, it seems to help families have some sense of relief and kind of knowing what to expect.
Yeah, that's great that you guys have the resources for not only just the medical pathology of type 1 diabetes, but also some things that could be associated with it as well. And so our clinic, I mean, you guys have already told us so many things that it has to offer, but there are other diabetes clinics as well. What would you say kind of sets your, like a Boston Children's Clinic apart, or what makes it different?
Yeah. I think we truly have an amazing team.
Yeah.
It's a pleasure to come to work, whether Zoom or in person, and really just hear everyone's opinions and ideas, and no idea is too small. We all just really respect each other and work together. And to know that our families have as many experts here, I think is wonderful. We are top ranked in U.S. News and World Report. We just work really, really hard for our families. Families first.
Yeah, I think just to add to that, it is really unique that you have such a diverse care team here. And so you get so many different expert opinions. And it really helps families, I think, to feel at peace and knowing they have several providers that they can outreach to, they can have conversations with. And we follow them, throughout childhood, right? And so as kids are diagnosed at a young age, they have the support, they get to know their team members, and really feel like they can reach out to us when they have something that comes up. And so having that super diverse team is really, really helpful for a lot of families.
And I think it's also really important for parents as well as kids to understand that they are not just diabetes. They are much more than that. Yeah. So, and that's where the connection really comes, is yes, I'm your diabetes nurse educator, I'm your coach. You're the captain of your diabetes team, and I'm here to help you. But there is much more to go with that. So, I had one family they would always say, WWGD, what would Gretchen do? Like before they would make something, right? Like what would she do in this situation? So making that connection is just such a powerful piece of our program here. It's awesome.
Yeah, I love that. So I do inpatient medicine, and so I do not see a lot of the stuff that you guys do on an outpatient basis. But I could speak volumes about how incredible the endocrine and diabetes team is on the inpatient side when we have patients with diabetic ketoacidosis, and your guys' support and education is just, I cannot say enough about it. So we're just so thankful and grateful for you guys. So we're going to change gears a little bit. What would be some helpful tips for families, and what should they know about diabetes? So the first question would be how to educate family members or anybody that may be in charge of the children.
That's a great question. So we actually, because this was such a popular question, we started a caregiver group recently. So families can offer, that can be preschool teachers, it can be grandparents, it can be anybody can attend that caregiver group just to kind of learn the basics of diabetes. And then again, because it's so individualized, meet with the family specifically to go over, these are her signs and symptoms of low blood sugar, or these are the foods that that child likes to eat. And the other part too is we always offer them to come to our appointments. Absolutely, the more the merrier. If you feel like there's someone who's really needs to be tuned in, we have school nurses come frequently, or grandparents to really learn how to best care for that child. The other part is the school nurse is our part of the team as well. So we do a lot of conversation and education with the school nurse. We just had a school nurse conference that we offered. It was extremely well attended. And thank you. Kareem did a great job on that too. But we really have a lot of opportunities, and I think it's important for families to know what we have, because I think part of our Family Advisory Council also, they were suggesting things and we're like, well, we have that, or we have that. So I think advertising and really getting families to know the opportunities we have is important.
Yeah, for sure.
And then another question, some of the children that get diagnosed with type 1 diabetes can be pretty young. I know that the average age was somewhere between 10 to 14. And so how do you talk to your children about the diagnosis and about managing their diabetes?
Yeah, I think it's a really good question. A lot of it depends on how old they're diagnosed, right? And so how much can they really understand? And so I think from a social work perspective, we certainly encourage parents and caregivers to think about what's a developmentally appropriate way to help your child understand what they're going through. If it's a young child, you're going to explain it a little differently than if it's a teenager or a young adult, right? And so providing that education and helping them to understand how things are going to change, but also how they're going to be supported, right? They're going to have their parents or caregivers, they'll have their team members. And so a really big piece we try to emphasize is just that open communication. They're going to have questions, they're going to be scared, which is totally normal, a very common response to a type 1 diabetes diagnosis. And so recognizing that and just encouraging those conversations when they come up.
Yeah, I love it. And I remember one of my friends, it just stands in my mind, is that he would check, instead of checking his blood sugar, he would check his sweetness. And he would wear his he would wear his Dexcom, and it's his dyno tracker, you know, like, so and that's when he was diagnosed. And still to this day we joke about it, that, you know, because I've been following him for years, but really just putting it in there, again, developmentally, in their perspective of what's important. And when struggles come up, please let us know. We have strategies, and we have ideas. We've seen a whole lot. I won't say we've seen it all, but we've seen a whole lot and have a lot of resources to help.
Checking their sweetness. I love that. I'm going to have to use that in the inpatient setting. Yeah, that's so great. So just to add to this, something I like to tell families, because I usually see them at the onset, like the initial diagnosis, and something that I always like to tell the families and the children is just that this diagnosis does not define them and does not define their potential, that they could still do anything and everything and become anything and everything they want to be. If they want to be NFL football player, they could do it. If they want to be a doctor or a dentist or whatever it may be, they could accomplish anything in this world that they want to, and that the diagnosis of type 1 diabetes should not limit them.
Absolutely. And I think at diagnoses, that's a really powerful statement for them. They need to understand that, you know, again, you are part of, you are a person first, and then you're a person with diabetes. And I think that needs to continue to tell, you know, to encourage them to do what they want to do. And I help run the Facebook page, and I'm always posting you know, anybody who has type 1, you know, Nick Jonas has type 1 diabetes, and that has not stopped him, right? So there's a lot out there. And really the key is for helping them to manage their control, you know, and I don't like to call it a disease. A disease is pretty negative. I like to call it a condition. How do we manage your condition to do what you can? So working with athletes, you know, and encouraging them, you perform better on the field if your glucose is closer to range. And, you know, those actors on stage, gosh, it's a lot of stress. So we need to, you know, address your numbers as you're there. So making sure that we can help them to manage their numbers. Their sweetness.
Their sweetness, yeah. And then before we get to the next question, one other thing that I usually add is just to let the parents know that there's nothing they did that caused this, right? Like that this diagnosis could be very shocking and there could be some guilt associated with it, but just to affirm to the parents, like, nothing that you guys did caused this. And if it's an older child, nothing they did caused this. It's just, unfortunately, whether it be genetic or environmental, that's what led to it, but nothing that they did that caused it.
Yeah, I think that's awesome to hear that you guys focus on that too. I think a big piece of our work early on is helping families to kind of normalize their reactions and their expectations. And like you said, recognizing it's not their fault, but that we can do things to support, that we can do things to help manage. And over time, they'll feel more and more confident. They'll become more comfortable with the calculations, with the day-to-day, with the routine, all of that. And so just building that over time, but giving them that idea that it will take some time, but they will certainly get there.
And I always like to encourage families to give themselves grace.
Yeah.
Just be able to, you know, take a deep breath, and we know what to do with these numbers, and it's not perfect. Diabetes is not perfect. Life is not perfect. And we do not expect you to have perfection. And I think that's really important for families to take a deep breath and continue to tell them that so that it sinks in.
Yeah, and life happens, right? Like you get a viral infection or you go to a party, like different things happen. Life happens.
Absolutely. But knowing how to get in touch with us. Someone is here 24 hours a day for urgent matters. They know how to contact us for guidance. And, you know, the upcoming field trip. Okay, we'll talk about it at our next visit. Or, you know, making sure that we're holding their hands as much as they need.
Love that. So speaking of life happening, the holiday season is approaching. So what would be some tips on how to navigate the holiday season with our kiddos with type 1 diabetes?
I think one thing for me would be to kind of plan as best you can, right? You know, like you said, there are some things that just come up we can't plan for, but having some conversation with your kids about what their expectations are, what your expectations are, and how you guys can meet in the middle. When we can kind of prep for some of those situations, I think it makes it a lot easier to be able to deal with. So whenever we can try to do that, we certainly encourage parents to get ahead of those things as best they can.
Yeah. And from a medical piece, giving insulin, making sure we're covering those carbohydrates, knowing how many carbs are in your grandma's favorite piece of apple pie, right? Using apps, using resources to kind of figure out. And it sometimes is a guess, but guessing the best you can. And making sure that you're giving insulin ahead of time to really start working before you start putting those carbohydrates in your body. But again, perfection is not expected. So have fun with your family, enjoy that time at the holidays, but don't forget about the diabetes.
And then would there be a time where, say, that maybe there's an item or a food item there that the child couldn't have? And if that is the case, how do you navigate that, telling your child that?
I don't think there's anything. I don't think there's a never. I think the biggest piece is to understand what it is, understand kind of the carbohydrates that are in it, because insulin is off carbohydrate accounts. So you have to count the right carbohydrates, give insulin ahead of time, and go ahead and eat it. And then it's a cause and effect. See what happens. And then next time when you have grandma's apple pie, you might want to take a little bit more because your body responded this way to it, you know? So it really, there is nothing off limits.
Okay, love that. And then also the fact that, you know, you're not going to know that what is in everything, but then to be able to almost be like a pharmacist or like a
you're
chemist,
a detective.
You're a detective,
You're a detective.
to figuring out, and it's not going to be perfect, but just modifying as life goes on.
Absolutely.
Yeah,
absolutely.
Very good.
Yep.
All right, so we also had a Q&A section where people sent in some questions, so we're going to answer a couple of their questions, okay?
Sure.
So one of the questions that were sent in was that the school nurse at my child's elementary school has decided that this past month to allow my son to take his omnipod controller back with him in school class. In the past, the nurse kept it in their office. Is this change within the safety guidelines? Am I personally just too nervous about this, or what would be your recommendations on that?
I love that mom thought she was nervous, because go with your gut. Always go with your gut. And I think it's, you know, this, again, the school nurse is part of our healthcare team. So when you're in school, the child's responsibility is to learn. And I think the adult's responsibility there is to really help them manage their diabetes. So I would encourage, depending on the child's age, I would suggest having the controller in the nurse's office, because I think it's really important for the child and the nurse to have that communication, to be able. Insulin is a really important medication, and you want to make sure, especially if it's a younger child, that there's an adult there to help supervise and help encourage them. Yeah.
Okay, great. We have a couple more questions. And so as teenagers get to being teenagers, life is busy. They have sports, friends, all these things. And so it could be easy to forget about their A1C or maybe not care about it as much. How do you think we can help our teens or our children care about their A1C?
Yeah, I think this is something that comes up for a lot of my meetings with my teens and young adults where, you know, like you said, they're going through high school or middle school, they're making their friends, they're playing sports, doing all these different things, and they're trying to balance diabetes with all these other natural developments. And so a big piece is trying to figure out how we can just fit diabetes into their current routine already. We don't have to completely change everything. We don't have to, you know, start from the ground up, but we can kind of find ways where diabetes fits into their routine, recognizing how important it is that they manage those things. And a lot of that is asking the kids what they think. You know, I really try to prioritize getting a sense of how this kid is doing, how their understanding of diabetes is, and what they need from me. And then it's a working relationship that we all share and kind of collaborating and figuring out what's going to be the best way for them to succeed.
And I think the other piece too is making sure that although they are teenagers, it's truly a team effort. You know, and having the parents be on board to really help support them as well, because there are so many other things in their mind right now that sometimes diabetes isn't first on their list, which is okay. But we want to make sure that they're healthy and safe.
Yeah, certainly.
And then one more question that was sent in, and you already kind of touched on it when we talked about the holidays, but foods that our children love. What are some tips about with carb counting and still allowing them to, maybe it's ice cream or cake, to allow them to enjoy those foods, and then just tips for carb counting around that?
Sure. So I think there's a bunch of different apps that are really great for carb counting. MyFitnessPal. There's a new one called Snack with a Q. Like you can actually take a picture of what the food in front of you, and it will give you an estimate of how many carbohydrates are there. So really, diabetes is only as good as the information you give it, right? You're giving it a blood glucose, and you give it the carb amount, and then we have a happy number afterwards, right? So really, it's just focusing on those things. And a lot of us eat the same thing all the time, or specific things. So kind of bringing those to memory as to, when you go to Dunkin' Donuts, this is what you get, this is how many carbs are there. And a lot of times in the office, I'll spend time looking up nutrition facts for someone who has a drink in my office, and we'll make sure that they remember next time this is how many carbs are there. So working with your team to kind of figure that piece out. And we all, we're starting to come together. We're doing a cooking class, a type 1 diabetes cooking class. So that will, one of the social workers and I do one every quarter, but this one is going to be a little bit more routine. So again, families can really understand the carb counting piece and some recipes, and fun. It's fun.
Yeah, I think another cool piece to that is a lot of kids that I've worked with for a long period of time. It's fun to see how good they get at being able to kind of estimate their carbs, right? Yeah. If they go out to get some pizza or they get their coffee, they know how many carbs are in those. And you just get to see that growth over time. And I think that's really special. Yeah. And being able to highlight them, to give them some praise in that is really cool, and it goes a really long way.
Yeah, after a few years, they're probably like the experts in it, right?
Absolutely,
yeah, definitely.
Absolutely. They're great at math, right? Because they have to be, right? But it's really neat. Or sometimes they'll come in and show me. I had someone come in and show me that snack app, and I'm like, that's awesome. Like show me these. I learned so much from my patients.
Yes, definitely,
awesome.
Definitely.
I love that. So as we close, if you guys could just give the parents that are watching just one piece of advice, or maybe just one thing you want to say to the parents with children with type 1 diabetes.
Yeah, that's great. I think I would say we all ask you to just do your best and give yourself grace.
Yeah. I love that. I think for me, my big thing would just be okay with just being open to talking about it. I think getting those feelings out about diabetes, whether you hate it, whether you feel really confident about it, whatever it is, being open about those things are so important, and it does make a difference. So just having somebody you can talk to is huge.
Fantastic. And if I were to give one piece of advice, it would just be to remember that your child's diagnosis does not define their potential. So thank you guys so much for joining this episode of Answers for Families, where we talked about type 1 diabetes. If you guys want to stay connected, make sure to check out our YouTube channel and go to the playlist of Answers for Families, and you can watch all the previous videos and stay up to date with the videos up and coming. And if you want another resource to learn tips for your children, make sure to check out the podcast ParentCast. Also, lastly, make sure to sign up for our newsletter, where we'll be sending out monthly newsletters where you'll get more information about Answers for Families.